Hello and welcome to another UK column interview. My name's Debbie Evans and today I'm joined by our very good friend Cheryl Granger, but I'm also joined by a very, very astute engineer called John Beaudoin. Now, if you have not heard of the name John Beaudoin, you will now. And where have you been? Because John is a very humble gentleman, but he is an extraordinary engineer who's got extraordinary, irrefutable data on excess deaths. Why, you ask yourself, how has this man got all of this data? Well, he asked for it, and that was very simply what happened. What do I mean by irrefutable data and extraordinary data? Well, I mean actually over 1 million death certificates. And yes, John asked for them and John got them. And I'm delighted to be able to welcome you from across the pond in the USA. John, welcome to UK Column and thank you so much for agreeing to talk to us today.
Good morning, and thank you for having me on UK Column. Really nice to meet you, Debbie and Cheryl. Hope we have a good conversation. I'm sure we will.
Oh, I can assure you we will. And on that note, let's welcome Cheryl as well, who many of our viewers and listeners will know. Cheryl is a self-employed pharmaceutical training consultant, and she's done much work with me on the MHRA, vaccines, excess deaths, and mRNA. So Cheryl, thank you so much for facilitating this interview and joining us today. Welcome.
Thanks, Debbie, and hello, John. Nice to be with you both this afternoon, actually, here. Yeah, thank you.
The plan is that we're going to show you a very short piece of video now, just to give you a flavour of who John is and what he's done, because I think you're going to find it extraordinary. And then I'm going to hand over to Cheryl, because Cheryl's going to do a bit of data crunching, because that's what John is all about. So without further ado, here's a very short video clip just to give you a flavour of who we're talking to today.
COVID, as I've proven in my book and in the CDC memorandum, a second publication, 80 to 90% of the COVID deaths are fraud. They were drug overdoses and car accidents, and they were a bunch of old people dying out of neglect and being mistreated by hospitals, weren't given antibiotics when they had a bacterial infection in their lungs. These things all combined through a coercion of doctors from the American Board of Internal Medicine, Family Medicine, Pediatrics, the state licensing boards, the Federation of State Medical Boards, the NIH, FDA, CDC, all said the same thing. You will use this protocol or we're going to suspend your license. And you can find that on the web. The letter is still there. It's a joint statement by the CEOs of the American Board of Internal Medicine and the other two I mentioned. So with regard to all of the hospital protocols, I call it murder because at some level, somebody knew what they were doing. More than 500,000 people killed by hospital protocols, another 500,000 killed by what they call a vaccine. I have all the data. I can show it. I now have 1.4 million unredacted, non-redacted death certificates. That represents 5% of the U.S. population. It's the biggest study, biggest database ever in anything COVID.
Thanks, John. I think that summarised a lot of what we're going to talk about today. We just want a bit more information. You say, and you've got 1.4 million certificates. How on earth did you get them? How on earth did you get to write an FOI and get them to be released? What was it about your particular request, you think, that actually allowed you to have all this Massachusetts data?
Oh boy, it's really simple, but it's not. So I spread 8 public records requests. Now that's the Massachusetts state version of the FOIA, Freedom of Information. And I spread them across different people so that the state wouldn't think it was all coming from one person and then just deny them all. So 7 were rejected. And the one that came through was the entire death record. And I say record instead of certificate because the certificates are actually the pieces of paper, right? The records have a lot more information. I have 315 different columns per decedent, per person who died, 315 different variables across a row of a spreadsheet. That's a lot more than is on a death certificate. So I have the medical examiner's name, license number, office address. I have the burial plot of the person, whether or not they were cremated, the causes of death, So I asked for it, and they gave it to us. And then they further said, you don't even need to do a public records request. You just need to ask for it. So in Massachusetts, we don't have privacy and death laws like most of the United States do. Most of them are 50 to 70 years. So that's how I got Massachusetts. Somebody did the same thing in Minnesota, unbeknownst to me, for over a year. And she was working on that. And when we found each other after over, I think, a year, and she offered me the Minnesota database, and I said, yeah, sure. So I got that. And then I recently got a third. Oh, and I work with a gentleman in New York City sometimes, Aaron Hertzberg. He got Vermont, which is great. It's a very small state, so it's hard to find signals, but you can find individual cases. And there are signals. I would get into that later. But and then I got another state, I guess I'd say a fourth state, very recently, and I'll have a third book coming out end of summer. So basically, I asked for them. That's how I got them. Oh, the fourth one, I almost don't want to say. I applied to do a research paper, which I am doing. I have engaged a gentleman at MIT who is just graduating now. He's also an electrical engineer, and he's going to use some discrete Fourier transform electrical engineering techniques to derive the seasonality of deaths by cause, where pneumonia would have high seasonality. More people die in the winter of pneumonia than in the summer in a northern climate. And then it doesn't matter with regard to, pick something like cardiac arrest. There's that's probably a bad one because that goes with pneumonia. Let me just say a heart attack. There aren't any more heart attacks in the winter than the summer. So there's no seasonality. So the signal to noise ratio would be different. Now I'm off on a tangent. So let me get back to, I got the fourth state, and I got it because I'm going to do a research paper, and I will, because I said I would. And there will be 100 times more incidental findings than climate change versus heart disease, which is what I applied to do.
Are you from Massachusetts? Is that why you got this data?
I live in Massachusetts. Am I from Massachusetts? No, I'm from Connecticut. And there's a very big difference, even though it's only 2 hours away. And it's between New York and Boston. So you hear people with a Boston accent and people with a New York accent. Connecticut does not really have an accent unless you get close to New York.
Have you had any pushback from the people who gave you these death certificates and your analysis? Has there been any reaction?
No, not at all. In fact, I don't think they can now because I sued the governor, the public health commissioner, the chief medical examiner, and 4 individual medical examiners in United States District Court District, Massachusetts. So they were probably under orders from the Attorney General's office to be quiet, not talk. Everything I've stated is factual, and it's sworn to under oath in federal court, which means they can put me in jail if I'm lying. And I'm not lying because it's their data and it's all true.
Yeah. And I've been working with the Pfizer Moderna document analysis with Daily Clout and all the information that they have, which is primary source information. So it's really been Pfizer analysis start off with. Pfizer haven't sued them because obviously they can't. It's their data. It's their data that they put forward for licensing. So it's the same sort of thing. But I'm just jealous of the fact that in your system, you can actually get answers to your freedom of information without people hiding. So you have done a lot of comparisons to theirs to find these people that you have death certificates for. And I'm interested in that because you talk about people as people. You talk about these poor souls who have unfortunately died and make the links about them. That must have been very difficult for you to do, but I think you started off with a Cassidy Baraka.
Yes, it is difficult. I hate to say, but human nature makes it easier over time. And now it's hard again because I grew up in this state, the fourth state that I now have. And as I dive into it, I see people from my hometown. And so it became difficult again. But with Cassidy, I wouldn't write the name for a while, and then nobody was paying attention. And if you don't say a name, people don't believe you. So I looked up the obituary, the public information. So everything I say is public information. I'm not, by law restricted. so I did use her name because it's so important to save the living children. And I think she and her mother would want that. And I've not contacted her mother for other reasons. I was going to, but I was told not to. There's something that I think they threatened her to be quiet. And I won't talk about that now. It has to do with a certain agency in Massachusetts. But yeah, it's very difficult. And the important thing is to use the names, because everybody else out there who's listening, this is not just data. And I know that we're going to talk about data today, and people call me the data guy, but most conclusive evidence is an individual person who who had a reaction. And what I did was I correlated the VAERS by looking at the age, the gender, the state. Okay, how many people died in the state around that time? There were 4 7-year-old girls who died around that time. And in my book, in chapter 1, I go through all 4, and I show how the other 3 cannot possibly be the person in the VAERS record, which the VAERS records are anonymous. There's no names. But it has to be Cassidy. There's no question it's Cassidy. And in my lawsuit, I'm asking the state to tell me, did you write that she died from COVID? Whereas I know she died from the vaccine. Tell the truth. I'm asking the judge to compel the state to tell the truth, because all the parents that read that in the newspaper and listened to it on television, it was on all the TV stations, 7-year-old dies from COVID. They all got their kids and they lined them right up for that shot and put them in harm's way. And I have many that I've correlated. With the new state, I just found 41 vaccine deaths that are correlated to VAERS. In Massachusetts, I have about 50. In Minnesota, I have about 50. And then there's 9 in Minnesota that actually state the vaccine killed them. And in Massachusetts, there are 10 that state the vaccine killed. And in the new state, 4 state that the vaccine killed them. But the CDC only coded the first 3 in Minnesota, the first 1 in Massachusetts, and the first 1 in the 4th state. And they stopped coding them after that. And being that it's an automatic software program that codes the English words sent to them on the death records, that means somebody either deleted the codes after they were generated, and the code specifically is Y59.0. And I can talk about how that's applicable to the UK in a moment, if you want to go there. But Y59.0 means viral vaccines. And that was generated for Solomon Kizito, who died on January 16th in Massachusetts in the year 2021. That's only 2 weeks into the vaccine program. He died. And it says it right on his death certificate. He died from acute bronchopneumonia in the setting of idiopathic thrombocytopenia. Idiopathic meaning we don't know where it came from. Well, there's all kinds of papers showing how thrombocytopenia is frequent from these vaccines. And we again, it's another thing we can get into. That's chapter 2. I show where that there's a paper, Fatal Post-COVID mRNA Vaccine-Associated Cerebral Ischemia is the title. And it says in every paragraph, the vaccine killed the 30-year-old woman by stroke and so forth. So the CDC for the next 9 did not code the word vaccine or vaccination, where people died within 5 minutes of the vaccine, or 1 or 2 hours later, or the next day from a pulmonary embolism, or a cardiac arrhythmia, or a thrombocytopenia, all very common from this vaccine. And I show death, 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 death. They knew within weeks of this vaccine, they knew that it was killing people, and they've been hiding it. And that's why I say that, data is good, but individual cases are conclusive evidence where data is persuasive and supplemental to the conclusive evidence.
It's always very interesting to put a name to these cases, John, and you're saying that this is something that has been miscoded in the UK as well, and that presumably this has been happening all around the world.
I can't say miscoded, but it's been avoided being coded. I would have to see the individual records from the UK, and the governments are hiding all the records from the people. Now there's a few of us that have gotten these records, the woman in Minnesota and Aaron Hertzberg in New York. But we're talking worldwide. We have, 3 people who've gotten these records? Bobby Bounds got some Nevada and New Mexico too. So that's 4 people. Yeah. So in the UK, the Y590 that I was mentioning has to do with the U12.9. U12.9 is specific to the COVID vaccine. And I testified in New Hampshire with a bunch of factual information for maybe 15 minutes or so. And the woman who came up after me from the Department of Health and Human Services of New Hampshire, chief of the Bureau of Statistics, I believe, within New Hampshire, stated that in preparing for the meeting, she had her staff look at U12.9 and there were no deaths from COVID listed. What she didn't know in stating that is that the United States and the CDC did not adopt U12.9. It is not mentioned in the CDC at all. I combed through everything. However, I did find that it is used by the UK and it is used by Germany in the context of death by COVID vaccine. But there's a specific note under that in the UK. And that note states it's a subcategory of Wi-Fi 9.0. So you should see Wi-Fi 9.0 just like the United States uses Wi-Fi 9.0. You probably won't see U12.9. It needs to be looked at. Find out how many hundreds are coded that. And if you find them, that's only the tip of the iceberg because the others are probably being hidden like they did in the United States.
I mean, we've had some changes made to UK death certification when this all started. So because we had a Dr. Shipman who basically bumped a lot of people off to basically have a monetary gain, older people were put to sleep by him. And because of that, they changed the rules that you had to have two doctors sign the death certificate until COVID came along. And at the beginning of 2020, they reduced it down to one doctor, and the doctor didn't even have to see the body. They could actually certify the body remotely. So the whole thing was open to a lot of interpretation. I know this. My mum-in-law, who was 101, died. Fortunately, on her death certificate, it says she died of old age, which obviously I couldn't argue with. But at the end of the day, a lot of people, because they hadn't been seen, and a lot of people at the beginning, as you'll go on to say, were in care homes. They were elderly people. They actually were basically said to have died of COVID. There were no autopsies being done, which obviously when a new medication comes out and there's deaths, autopsies have always been done until this year, 2020. And also the coroner's office in the UK don't seem to be centralised. We seem to have every coroner's office acting independently in terms of getting information. So that makes it again another difficulty, but it's similar but different in the UK. You've talked about errors in the certification, omissions, extremely rare labels, malfeasance being acted on, and deliberate fraud happening. So you've talked about federal felony because the omission of root cause of death has been omitted. And you talk about different types of fraud. You talk about fraud of commission and fraud of omission. Can you tell us a little bit about that and whether there are any court cases that have come out of that knowledge?
With regard to the fraud of omission would be omitting vaccine as a cause of death where the certifier knows that the vaccine caused the death. In such a case, Cassidy Baraka, somebody wrote a VAERS report, so they knew. They wrote that report before she even died. 2 days after she was injected, they wrote the report. And then expecting her to die, and she did die. With regard to Breonna McCarthy, 30 years old, they wrote, the doctors at the Beth Israel Deaconess Medical Center, Harvard Medical College, wrote a 6-page report. And in that report, they stated in the title that she was killed by the vaccine, by stroke. And in every paragraph, they say it. In fact, they say a number of reports on these COVID vaccines and several reports. And they also write where CVST is not in this particular case, because Breonna died from an ischemic stroke. It says, although this is not a CVST, which means cerebral venous sinus thrombosis, it's a type of hemorrhagic stroke. While CVST is not, she did not die of this. There are several reports of CVSTs occurring from these vaccines where thrombocytopenia is frequent. Okay, they're using words several reports, a number of reports, and frequent. And yet 2 weeks before Breonna was injected she was injected on March 30th, 2021, like 8-9 weeks into the vaccine campaign. 2 weeks before that, in Massachusetts, not far away, Diane Dubois was 62 years old. And on her death certificate, it actually says, and it's not coded, okay? It actually says acute intracranial hemorrhage in the setting of thrombocytopenia in a person vaccinated 11 days prior. It says vaccine on her death record. It does not get coded with Y5 9.0. It is fraudulent. They know it. They're doing it on purpose. So it's fraud of commission in the fact that, it's fraud of omission by omitting the Y5 9.0. The fraud of commission are all the acute fentanyl overdoses, blunt force trauma to the head, blunt force trauma to the torso. They're testing dead bodies for COVID. It was not causal in their death. It is very clear what goes on a death record. It has to be causal in their death to be under the causes of death. And that's part 1, A, B, C, D, right? In reverse time order. The most recent thing that happened, like they stopped breathing, would be, or that their heart stopped. That's cardiopulmonary arrest. They both stop. That's the last thing that happens before death. It's called the immediate cause. That's in cause A. So the writing down that they died from COVID is a fraud of commission. And they've done it over and over and over. I have hundreds of accidental deaths labeled COVID. And then I've spoken to, I interviewed a medical examiner for 3.5 hours, reviewed hundreds of death certificates with him. And he told me nobody came to the office during that first 9 weeks of COVID. And in Massachusetts, there's like almost 9,000 people, 8,800 excess, more than normal deaths. Mid-March to mid-June of 2020, that drove the fear of the pandemic worldwide, along with New York City and New Jersey. I can talk about that in a few minutes. Massachusetts kind of did this to the world. There's a reason for that.
You're talking about codes there. And in the UK, we have something called ICD codes. We have diagnostic codes. And we do have a code for unvaccinated, but we don't have a code for vaccine injury. And I think one piece of data that I found particularly striking when you were talking about it, and I think you were just going to perhaps hint on it now. But before I go to that, I want to say to people that are watching and listening that Cheryl will show you in a minute John's book, but everything that John is talking about today, he's written the most amazing book. I don't suppose he ever expected to be writing a book like this in his lifetime, but therealcdc.com, and that's C with a little d and a big C. We'll have that on the screen, and maybe John can give us a bit of an answer of why it's called that, because there's a good reason behind it. However, one of the things that first triggered you into a bit of a red flag, John, was that what you were talking about there was respiratory deaths in 2020 were coded J. You were seeing them as a J code. And so those were up in 2020. But then following on from that, the J code kind of fell off the radar and was replaced with other codes, with other conditions, with people much younger, because you were getting death certificates. I think it's important that we highlight this to viewers and listeners. You were getting them unredacted. So you were getting their names, their ages, their addresses, their medical histories. I mean, the most phenomenal amount of information. So when you started to see that the J code for respiratory conditions, which makes sense with a respiratory illness, was suddenly disappearing, what were you noticing from there on? What kind of codes were you seeing in replace of the J code?
Yeah, so I mean, I'm an engineer, not a biologist or a doctor, and I didn't even know there were codes. What I did was I noticed certain things were happening more, and then I saw these codes way to the right, and then they're international, so your codes are the same as our codes. We just each nation adopts a subset of the overall codes that are put out by the WHO, but they're all the same. So J189 is pneumonia unspecified. J12 is viral pneumonia, and J15 is bacterial pneumonia. That's important. I'll stress that in a moment. But what I did was I just typed all the codes in, and I created a quick search tool. I did a lot of spreadsheet calculations and formula, and I put them all in a column, and I had 2020 versus 2021. Which one is in greater excess from 2015 through 2019. So 2015 through 19 is the baseline. And looking at 2020 and 2021, which one is greater? And the J codes, which are all respiratory, flu, ARDS, COPD, pneumonia, they all lit up in 2020. That was in greater excess than 21. And then when I got to the I codes, which are circulatory, and the D codes, D for Delta, which are blood and blood-forming organs, the I codes and D codes lit up in 21. So they were in greater numbers. And so I started then looking for hotspots in standard deviations above norm. And pulmonary embolism popped out big time. So I looked at pulmonary embolism. And pulmonary embolism went up. It went up in the year of COVID because a lot of old people didn't get out of bed. They were left in bed and had clots, right? So they ended up with pulmonary emboli just by the nature of 8,800 excess deaths. When I divide by the number of total deaths in the year, pulmonary embolism kind of disappears. It didn't really happen in 2020 in a prevalence factor, right? More than normal. But in 2021, it went up substantially, like a lot. And in 22 also. But back when I first did it, I only had 2 months of 22. So I was really looking at 2020 and 2021. So pulmonary embolism in I26.9, pulmonary embolism without mention of acute cor pulmonale is the name of that. That went up substantially in 21, not in 20. But COVID at the same time went down. Pneumonia went down. So year over year from 2020 to 2021, you have all cause go down. The marginal difference was cut in half. The pneumonia marginal difference was cut in half. The number of COVID deaths were cut in half. While at the same time, pulmonary embolism, a clot in your lung that kills you from ventricular failure, that went up substantially. That's the opposite direction. And so I looked at all the other codes, and I'll just rattle them off, like acute post-hemorrhagic anemia. That's sudden blood loss anemia. Non-traumatic, because I have the individual records. I could look through the 100 records or so and find that 89% of them had no trauma. That means the steering wheel of the car didn't hit them and rupture their aorta. They didn't have a surgeon make a mistake. These were, all of a sudden you have a hole eaten through some major artery in your body and you bleed out in your body and die. That just doesn't happen like this. All these things started happening more after the vaccine. So acute post-hemorrhagic anemia, thrombocytopenia, acute, cardiac arrhythmia, cardiac arrest, pulmonary embolism. The difficult ones were the neurological. It took me another 3 or 4 months to find those because there are about 50 different codes associated with neurological. And that means all the different kinds of strokes, brain herniations, hemorrhagic strokes, ischemic strokes, what part of the brain. By the time you look at all the signals, every one of them is so small that it's easier to go through the individual records. And that's why chapter 2 is about 3 strokes in 3 women, just to show the world that 3 women died in 3 months very early in vaccination, and they were all covered up and hidden by the government of Massachusetts.
Just before I ask you something else, John, I want everybody to see your book, which is a really easy read. You've written it for the common man to actually understand. Do you want to say a little bit about why it gets that title and why you've got your T-shirt on with the same emblem?
Sure. So my friend, Marc Giraudeau, whom you may want to interview, he also came out with a book recently, but he's in France. And I was in a group with Steve Kirsch, Marc Giraudeau, Kevin McKernan, Jessica Rose, Stephanie Senoff, Byron Bridle, Matthew Crawford, and a few other people. We talked 2 hours a week. And I wanted to write a Substack, and I wanted to be anonymous at the time. And so I have a black dog, and I created a logo that Steve Kirsch didn't like, and he made me use just the dog's head. I had the profile of a dog squatting. He didn't like that. So I just used the head. But I wanted it to be called Bad Dog or Naughty Dog. And I said, Mark, how do you say that in French? And we went back and forth like 5 times, like, no, that's not what I mean. No. I said, Mark, what would you yell at your dog if he pooped on the floor in the house? And Mark said, coquin de chien. And I said, okay, that's what I'll use. So I used coquin de chien. And that was my Substack name for a while. And that means bad dog or naughty dog in French. Well, serendipitous to that is the fact that the initials are CDC, where the D is lowercase. for the de, coquin de chien. That's where it came from. Mark talks about the bolus injection, how that's largely responsible for most of the problems.
Just to say, you can get it off Amazon. I had to go to Amazon US, but they would deliver, so that's good. That's how I got my book. So you mentioned about seasonality. So you talk about seasonality profiles and age spectrum profiles, and then symptom profiles. So seasonality, basically, we're used to infections like flu starting off in Australia in this country and then eventually getting to the UK. In 2020, we had COVID everywhere. So what do you have to say about seasonality and the behaviour in 2020?
So with seasonality, especially in the northern climates, you'll have more respiratory deaths, associated deaths in the winter than in the summer. And when you look at an all-cause deaths analysis, or just a waveform of all the people dying in a society in the north, you will see a sine wave. I've been told it's not a sine wave. It's like, well, it sure looks like one. It's pretty close. There's more in the winter than in the summer. And then if you look at pneumonia, you'll see more in the winter than in the summer. And if you look at COVID, you'll see it enter, say, Massachusetts around March. So it didn't start in November like a normal full season would. But then it goes down in May, and it was pretty much done in June. And then it came back in November, and you have a second wave. And then in the third wave, which is non-existent, COVID's been over for a couple of years, if you even believe there was COVID. So that's just to establish what seasonality is. What happened when you start stripping away like what's normal and you go looking at individual causes, and you find that pneumonia was up. It was up in the first wave of COVID, and then it diminished like it should, as a disease would, in the older population. However, very interestingly, after they started vaccinating people, death by pneumonia in the younger people, and I mean like 25 to 75, you'll see as you get younger and younger, the third wave is greater than the first wave. You tell me what disease comes in that somebody survives 2 years of, and then in the third year starts dying of pneumonia? I mean, so if you look by cause, you see that the seasonality, it's kind of backwards, right? But now let's talk about something that is not seasonal, like cardiac arrhythmia or things like that. When you strip away all the normal, what's left over is a signal that is a linearly increasing line that resembles the uptake of vaccine. So you don't have and you say, oh, well, that's COVID. Oh, COVID causes that. You know, I was hiking and a doctor I ran into, I coached his son in football, English football, United States soccer. And he knows that I lost my son, and his wife is a pediatrician. He's a cardiologist. He said, what are you doing lately? Because he knows I'm depressed. I was like, I'm just writing a book. Oh, what's it about? COVID. And then, that's a serious disease, I was like, yeah, okay. And then it came to, I'm a cardiologist. I know. I'm like, okay, what about eosinophilic myocarditis or lymphohistiocytic myocarditis? And he starts walking away and he turns around and says, that happens with COVID too, Yeah, no, it doesn't. not like this. So the prevalence of the seasonality of things like, I don't like to talk about myocarditis because it's only 1% of the overall deaths. I think it's over talked about. People are dying of many things. If you look at pulmonary embolism, it went along with the uptake of vaccine. It did not come in seasonally with COVID. It was not shown to be more prevalent in overall death in 2020. It happened in 21, and it happened along with the curve of the uptake of vaccine, which is a linearly increasing curve, not a seasonal respiratory or seasonal curve. The same with thrombocytopenia and all the others. So the seasonality of when people die throughout the year has an association mostly with respiratory stuff. If it gets really super cold, then people do die of heart attacks. And there's probably some reason, like, I don't know, they're snow blowing the snow away and we're trying to shovel too much and they die of a heart attack. But there is a signal, but it has to be extreme. It has to be extreme cold or extreme hot. They die of heart attacks. So yeah, I've proven in the data that respiratory type illnesses die more in the winter than the summer, but they're dying more in the third wave. So when you start subtracting out what should happen, it's like, well, this shouldn't happen. Why are people's the immune mechanism, the I8 and D8 codes, mostly the D8 codes, the immune mechanism, it's out of whack. It has been from the very, very beginning of the vaccine, not COVID. It's very stark. It starts in 21, not 20. The biggest wave of COVID was purely in 2020 in Massachusetts. And so these differences in seasonality are very stark, and they show that it can't be COVID, it must be something else. And so I'm saying that something else is likely the vaccine.
I mean, I find it fascinating that you've got all of these death certificates, that anybody would even think to send them to you, quite honestly. But the fact is that you have got them. And I'm just thinking to myself, well, how do we in the UK get data like this? We're probably not going to get it. But one thing that you didn't, I'm presuming, wasn't on the death certificates was vaccination status, because we don't seem to have any data with the correlation of vaccinated and unvaccinated. And if we had that, I guess that would be the holy grail. But am I right in thinking that you didn't have the vaccination status on the death certificates?
That's correct. I use the VAERS database to correlate. I wanted to make sure that I have the right person. And that's where there's a chapter in the book that says VAERS correlation. I can't remember the name of the title of the chapter, but it's where I correlate the two. And the correlation is sound. I show you every person who died, that is that age, that gender, died on that date, right? Because sometimes the VAERS records say the date they died. And then I find other conditions and writings within the VAERS record. In fact, there's one 12-year-old girl. It appears that somebody wrote the VAERS record using the language from the death record, which is cerebellar, tonsillar, and bilateral uncal herniation. It's the only time I saw that in a million records. And there it is. It's in both the VAERS record and the death record. And she was injected on March 3rd. This is where I get the injection dates. On the VAERS record, March 3rd, 2022. She died on March 29th. She had 4 injections, 4. And that was HPV, meningococcal, Tdap, and her 3rd COVID vaccine. 3 in her left arm, 1 in her right arm. So yeah, I have detailed information from those records. And in fact, I told you earlier, some of the death records actually state that the vaccine killed the person. And because they're not coded by the CDC, like I said, the first 1 in Massachusetts was coded, the next 9 were not. The first 3 in Minnesota, the next 6 were not. The first 1 in the 4th state, and the next 3 were not. Meaning, it says it on the death record that the vaccine killed these people. And if you extrapolate that, you have hundreds across the US, but you don't see it in the data. And that's all anybody can find is the data, like in the UK, right? You need to see the data being the codes, the ICD-10 codes. That's all you really get to see. You don't see the individual writings. What did the medical examiner or doctor write on the death certificate? And that's why record level source data is so important. And I could really tell you how many of the papers written around the world by all the PhDs are wrong because they're making assumptions as to the underlying meaning of the codes and the data, especially with regard to cardiac arrest. I got something coming out on that. Past 30 years of papers using I4 codes are probably wrong.
I think it's important that we also remind our viewers that the VAERS data that you get in the USA is very different from the MHRA data, which we get here, because we've always said that with VAERS, you get a lot more detail. With the MHRA data, we get absolutely nothing. But it's not just the injections that you've noticed. And I know that I'm going to hand over to Cheryl because she wants to ask you about serious adverse reactions and also remdesivir. And there's so many questions we both want to ask you. I think we're going to have to ask you to come back, if you'd agree to, for a second time, because I want to ask you also about antibiotics, which I've noticed that you've noticed, and I'm feeling that that is of great significance. So I'll hand back across to Cheryl to pick up where she left off. And then maybe if we've got time, we can just briefly talk about the future. So over to Cheryl.
The cardiologist you spoke of a little while ago, these are doctors that are seeing things that they don't normally see and yet are not noticing them and recording them. Or if anybody talks about these things, it's always extremely rare, very rare. I mean, I don't know how you classify rare, but it's not the way that I classify rare when we've seen this data. The AstraZeneca vaccine was running at about 1 in 253 doses as serious adverse reaction, and Pfizer in the UK was running at 1 in 535 doses. So it's not rare, and it just depends what that definition is. But when we go on to acute renal failure, when we've got remdesivir, that of course Fauci, you mentioned, was involved with, and his wife, then we've got remdesivir being given out with COVID shots, with an immunomodulator and vancomycin, which is obviously a serious antibiotic. All of these things reduce immunity, and they also have effects on the kidneys and hepatic effects. So when you're seeing acute renal failure, do you blame the protocols that were being followed?
Absolutely. I have something new coming out, whether they died in hospital or not. And it's very difficult to see because most people who die from acute renal failure, acute is sudden, right? You didn't have a problem before. Now all of a sudden you have a problem and you die from it. But it still went up despite the fact that you'd expect all acute renal failure deaths to end up in the hospital because somebody's kidney's not working, they degrade. It's like, oh, I'm feeling terrible. I go to the hospital. Oh, your kidneys are failing. Oh, you die, right? So, but it's still up. And the fact that it's happening in hospital more than not in a marginal difference of data. Let me forget about the data and just get to the point here. The United States has hospital protocols different from other places. I'm asking somebody in Europe. I have a couple of people I've asked. I won't say their name yet because they haven't agreed to do it. If they can show acute renal failure in the UK and in Europe different from the United States, then we can show that the hospital protocols were different in the United States, and it was the hospital protocols that killed the people. We're not talking about a few people. This is 153,000 excess people in the last 3.5 years from acute renal failure alone. That should be the biggest single cause of death since over 100 years from something in the United States. I'll just say Ed Dowd and Finance Technologies will be coming out with the same study. They're a different group than me. They're using a different database than I have, and they have different people and methodologies than I'm using, and they came up with the same number. It's the biggest story nobody's talking about. And is it? You mentioned vancomycin, so antibiotic, that's vancomycin. They're giving it for sepsis. The person's probably going to die anyway because their immune system's shattered. And it's too late at that point. But it seems in the records, and I have 5, maybe 6 different patients' records. That's in the CDC memorandum, my second publication. They were given, 2 were given baricitinib, 2 were given remdesivir, all 5 were given vancomycin. And the timing at which the liver enzymes and creatinine levels, the tests for kidney function and liver function, it didn't seem to start failing until after the vancomycin. But I don't know, is it the vancomycin in combination with remdesivir? Or you mentioned an immunomodulator, that would be baricitinib as one of them, I believe you're talking about. These were all incentivized for the hospitals to use. A 20% adder on $1 million hospital stay is an extra $200,000 to pump remdesivir through somebody's veins on simply a positive COVID test, even if they're sitting there with 95% oxygen levels and normal vital signs. And they did do this. They did it to many patients. The important thing about acute renal failure is also that it's not just the old people dying. This goes down into the 25 to 44 range. I have new slides I've generated. I just did 121 last night. 121 different sets of graphs, each being 6 graphs per set or 3 graphs per set, depending on which slide it is. So that's like 400 different graphs I just generated for acute renal failure. All the way down at 25 years old, there's a 100% increase, 100%, which totals 150,000 people. And the life years lost for these young people with families, they have parents living, they have children, they're being killed because they get a positive COVID test going in the hospital, and the hospital starts them on a drug protocol put out by the NIH And the NIH knows darn well these people are dying and they're still killing people. And that's murder. I hope I answered the question. Sometimes I go on a little bit.
We're grateful for your answer. In the UK, it was midazolam and morphine that was particularly used in the care homes. And that obviously, that's a death row drug. And I don't know whether much midazolam was used in the States, but not only was it a lot was ordered, they used 2.5 times the annual amount in about 3 to 4 months, and basically at very high doses. And why would you give midazolam and morphine, both respiratory depressants, for somebody who got a respiratory infection? It doesn't make sense. Those are the products that we're very worried about. But in terms of what might be coming our way, I know Debbie has major worries about vancomycin, and how they're even talking about pediatric doses of it, which sounds quite horrific to me.
I've listened to many of your interviews, John, fascinated, and I've been looking at antimicrobial resistance, and I've been looking at the use of antibiotics, and I've been looking at what we've been using in the UK, and we do use vancomycin, but there's another one that I'm looking into that's part of the same family. And the dangers of vancomycin obviously are renal failure. And with the agenda moving forward, and with all that you've seen with the whole COVID narrative and the COVID data and the people associated to that data, I'm wondering if what we're looking forward to is another pandemic, but this time of antimicrobial resistance, where we're going to be looking at more mRNA shots coming down the line for AMR, probably mRNAs, more combination novel antimicrobials, which of course takes into consideration not just antibiotics, but it takes into consideration antifungals and antiparasitics as well. So the whole family of antibiotics. And I don't know, noticing what you had noticed in that people were getting really sick, and was that the contraindication? I just wondered what your thoughts were with regards to moving forward on antibiotics, because what we're seeing here seems to be a narrative that's pointing towards Shigella, E. coli, Cryptosporidium, water-based, wastewater and clean water. And we're looking at E. coli being one of the most studied organisms in history, but Shigella being particularly dangerous, and a new variant that may require a new antibiotic. What are your thoughts moving forward on that?
Oh boy, the antibiotic question. That's a tough one. There's just so much to it, and I'm not a doctor, I'm not a scientist, I'm not a biologist. I was given a combination of streptomycin and penicillin at 4 years old, and I went completely deaf in my right ear. And that's how they learned you can't mix those two, you'll cause small children to go deaf. Why did they give me the shot? Because they did not have a vaccine for the Hong Kong flu in 1968, so they wanted to make money on injecting something, so they injected that. That's where my antibiotic life starts. I think antibiotics have saved my life a number of times with strep throat, bronchitis, 104-degree fever. There's a place for them, and I believe strongly that antibiotics are important for the immune system. The immune system, if you're vaccinated, is absolutely crushed. Your bone marrow and lymph prove that. Not only is at the beginning of the cancers that I showed 2 years ago. In fact, lymph node cancer is now up 400% of normal in Massachusetts. But everything else that we're talking about, thrombocytopenia, one would expect, and I thought, you're not making enough platelets. I said platelet creation or thrombocyte creation is dysregulated. I might have been wrong in that it's not that you're not making enough. It's that your macrophages, certain white cells that eat up your dying platelets, are dysregulated in that instead of eating the senescent or the dying platelets, so every 10 to 12 days they die, right? Your platelets, they're always being replenished. But if your macrophages are out of control and start eating the healthy ones, that will cause thrombocytopenia. So the blood and blood forming and creation of these cells that basically kill pathogens in your body. There's T cells, B cells, lymphocytes, leukocytes, neutrophils, eosinophils, all these macrophages, all these weird names for white cells. Let's just say white cells. The creation of white cells at the stem cell level is being dysregulated. You're creating cells that you don't need, and you're not creating cells that you do need. So now you're open to certain pathogens attacking you. Shingles was on the rise after the vaccine. RSV was on the rise after the vaccine. All kinds of stuff that were latent. They were latent in individuals because those individuals had natural defenses for decades in their own bodies against those things. And when their immune system was crushed by the vaccine, you have antibodies against the spike protein now. It's like, oh, great, but I don't need that because that's not even circulating in society anymore. And you just crushed my immune system, so I can't fight off other things. So with any of these mRNA vaccines, the body is going to be disrupted. It's not just about the spike protein, it's mRNA technology. It was never safe. They brought it forward they went past all the regulatory normal licensing of so many years. The antibiotics, vancomycin is a last-ditch effort to save somebody with sepsis. They have multiple organ failure from it.
The adenovector virus injections, so like AstraZeneca, they are also responsible for thrombocytopenia as well. So it isn't just the mRNA. Obviously, the DNA ones go to mRNA. But we have a court case over here. I don't know whether you're aware of that. And that is under a Consumer Protection Act. So we basically are saying it doesn't actually do what it says on the tin. It's not safe and effective, and that's been shown. And basically, there are about 480 cases in yellow card of thrombocytopenia, and it kills about 1 in 5. Unfortunately. So there's a court case ongoing at the time.
Yeah, absolutely. Thrombocytopenia is huge. The signal on that across all the states that I have is very high. And there's different kinds. And the problem is the government that's supposed to be about healthcare and doing all this research is doing nothing because the signals are strong. I prove that. For example, I'll use acute renal failure again for an example. 150,000 excess people, and all it would take is 1 man week for them to look in some files to figure out what is the sequence of events with vital signs, medication being given, blood labs, and the different things that are being caused in people, sequelae, as people say. It is not hard for them to find this. They're purposely not looking. And that means they're killing a lot of people through their inaction where they have a legal duty to act concurrent with their inaction. Now back to thrombocytopenia, another signal. They're not looking at it. They could study this. Is it a lack of production of thrombocytes, or is it that the macrophages are eating your good thrombocytes so fast that you have low platelet count? And how is clotting happening at the same time of not being able to clot? These are things that they did exist. We had these names for very, very, very rare things that are now happening frequently. And the doctors, most doctors have never seen these things in their careers. Some have not seen something in 10,000 patients, like a neurosurgeon doing a brain operation back in 2020. Now, this is how I know that, or how I believe that COVID causes the same thing the vaccine causes. It's just so rare, there's no signal. So I do believe COVID is a real disease, and I do believe it's prothrombotic. It causes clots, but very rarely. Otherwise, it's just a bad cold. A surgeon was operating, and he was removing a clot in somebody's brain. While he was removing it, he saw 2 forming right in front of him. He'd never seen that in thousands of operations. That's specific to COVID. And then there are other things. But yeah, so they're not studying it. Thrombocytopenia is frequent. There's vaccine-induced thrombotic thrombocytopenia, heparin-induced thrombocytopenia. They're giving too much heparin because people are clotting. So they give them too much heparin in the hospital, they get thrombocytopenia. There's all kinds of reasons. Unfortunately, you don't have the detailed records to figure out what is the root cause of this particular thrombocytopenia. Does it present in purpura, the red splotches on your skin? That's extremely dangerous because if it's presenting on the skin, what's happening in your body, in your organs, in your brain, in your lungs? So that's another one.
mean, I want to ask you about long COVID. I want to ask you where flu went to. And I know that Cheryl's got a load more questions for you as well. But before we ask you if you would be happy to come back and talk to us again, I want to ask you, for people that are watching now, because what we're seeing is a lot of people are saying to us, we're looking back and we're seeing that our loved one, our mother, our father, our brother, our sister was killed by the state. We're seeing that now. And it's very difficult for people to take a lot of this data on board and this information on board. And we're still finding quite a bit of resistance with families that find it too painful to hear and are still in denial. When do you think we will come to the tipping point where people will realize what has gone on in the past and what is still going on, and perhaps moving forward is going to come again and hit us in a different way? What can we say to people when they're saying, well, I know my friend down the road, her family, they won't accept it, but I know that person should have come out of hospital and didn't. How do we tackle situations like that?
Yeah. So you said I'm kind of a data guy, and we talk about data a lot. I hate data. It's very little of what I do. I'm a whole systems analyst, the whole system being the behavioral, psychological, sociological, economic, finance, and then, of course, the biology and stuff. I just don't even do it. And I'm looking at data. How does it all play? The CARES Act is a behavioral modification. The state medical boards are coercing boards. We call it topping off. You get about 60% of the doctors to comply with solicitation. You get another 30% with coercion. You get another 5% by making examples out of doctors like Merrill Nass, John Littell, and others. And the 5% you suppress on social media. Now, all this combines to make the average person out in society a little bit shy also about confronting their own mortality and what they've done to their family members, what they've done to their friends by saying, you should get the vaccine. So there's a little bit of guilt and culpability in each person. But I don't like to use broad sweeping statements, which I just did. But when it comes to individuals, everybody's got a different reason. And yeah, it's difficult to approach a family member. I have cousins. One was doing horribly. She lost she's down to, I think, under 100 pounds. She was dying, and they did save her in the hospital after a year-long battle. She got all her vaccines and boosters and completely believes in it. Do I tell her? Do I say, hey, cousin, I wrote this book, you should read it, and this all has to do with the vaccine? It's tough. It's tough to approach people that you know and say, you did this to yourself. But they didn't do it to themselves. That's the problem. They need to be told, you're not at fault for this. The government did this to you, and they did it on purpose. So, I mean, I know what you're asking. It's hard to answer because it's individualistic. Each person is different. I can be brutally honest because that's been my personality my whole life. I'm an engineer. Tell it like it is. I try to use there's a little trepidation in approaching some people, but I try to just say, hey, I don't care if you're going to hate me. Doesn't matter. You need to hear this because you know what? You might prevent them from getting the booster that kills them. You might lose a friendship. You might have a relative be angry at you for a year, not talk to you, but you're obligated morally to tell them. And if they hate you, so what? But the next time they go in to get that shot, they might be thinking about what you said. So be brave and tell people.
John, where do we find you? There's going to be a lot of people watching that because you have put out an extraordinary amount of material. There's slide presentations, graphs, all of your evidence, your book, your website. Just let everybody know before I throw to Cheryl for her last word. Let me ask you where we find you.
So the book can be found at therealcdc.com in the United States. Unfortunately, I don't have anything set up for Europe yet to sell the book, it's my fault. I have to figure that out. It is sold on Amazon.com, and I was surprised that you even have a book. And, I don't know how you got it. You said Amazon. It's like, oh, they'll ship there? therealcdc.com. The book is on Amazon, Barnes & Noble. In Canada, it's on, I forgot the name of that place. It's on that big book sale place in Canada. I can't believe it escapes me. I also have a website called Via Vera Vita. I'm trying to move people away from it, but it still has a lot of data and it has a lot of links. If you go to therealcdc.com, at the bottom, you'll see links to my podcast interviews. That actually directs to Via Vera Vita, which means the way, the truth, and the life, John chapter 14, verse 6. So that's a good one, VIAVERAVITA.com. I'm prolific on Twitter at the @ JOHNBEAUDOINSR, John Beaudoin Sr. Facebook, I think John Paul Beaudoin. I don't do much there, but I'm trying to do more. And that's, Rumble channel. I just renamed my Rumble channel The Real CDC from Via Vera Vita. So now it's called The Real CDC. I'm moving everything to The Real CDC because it's easy. It's easy for people to remember. So Rumble channel, I'm going to try to start building the Rumble channel. And on Substack, kokandashion.substack.com, COQUIN.substack.com. I'll stop now.
Don't stop. Please don't stop, because without people like you, we wouldn't have this incredible wealth of knowledge. And on that note, John, I'm going to thank you so much for agreeing to join us. And I do hope you're going to join us again, because we've got so much to say. And I'm going to give Cheryl an opportunity to have her last word, but also to tell you, where did she get that book? Cheryl, over to you.
Me and my book, yes. I got it from Amazon US. And had to pay some postage, but at least they post it here. I can't remember exactly how much it cost, but I thought it was well worth the value, because we found out that more than 500,000 people are killed by hospital protocols, and another 500,000 have been killed by the COVID-19 vaccine, from all the evidence that's in this book. And the main strength that we have is in evidence, is in detail, is in understanding what's gone on, so that if there are people out there who have become ill because of the vaccines, they can actually do something, hopefully, to help themselves. First of all, by not having anything no more mRNA, whatever it is for. And on top of that, there are things that people can do to try and alleviate themselves from the damage that has been caused. And I just leave those thoughts with you in terms of understanding what John has been saying. I thank John very much, and I hope to see him again and have another chat.
And I too want to thank you, John, so much. And I'm sure that we'll talk again very soon. And if you like what the UK column are doing, please share this video, because this is vital information. And whoever it goes to, it might just save a few lives. This is really, really important. So, John, on that note, I'd like to leave you, as normal, as I always do, with grateful thanks and also your last word. And it's over to you. Thank you, John.
Thank you very much for having me and for this opportunity. I don't get to speak to a lot of people in the UK very often, but I know you have American audience too. So last words. It's over. It's been proven. I know I'm just one guy. I'm not a doctor, but the people of the world for 10,000 years, however long we've been on the planet, have had the ability to discern facts that are in front of us. And now, for some reason, we abdicate that ability to discern to somebody in a white coat. The white coat is not going to save you. The information is right in front of you. People are dying from this. It's clear. I've proven it over and over with hard, conclusive evidence that would stand up in any court. The CDC memorandum, my second publication, is a notice of criminal liability. It was served to the directors of the CDC, NIH, FDA, and their deputy directors. They now are in a knowing state of mind, and if they don't act to investigate, then they are guilty of the subsequent deaths, and that is murder that happened to other people. But conclusive evidence is what is presented. Somebody dies within 5 minutes or a couple hours over and over from the same thing. That is what I've proven. I don't need a research paper, a peer review. I don't need somebody in a white coat to tell me. So I want to thank everybody for listening. Use your own brain. This is hard factual evidence. It's irrefutable. That's the difference between what I do and a peer-reviewed research paper that gets bantered and argued and debated for the next 10 years. That's not what I do. I give you hard evidence. You can make a decision on your own. So make that decision, and I strongly recommend you stay away from what the government tells you to do, whether it's remdesivir or a vaccine. Use your own brain. Thank you very much. Appreciate everybody's time.